Good morning. I'm going to give just a quick update. It's been 12 days today since I had my surgery done. They removed and replaced some disc in my cervical area. I have some screws and rods and a little plate in there. They went through the front, so I have a pretty big incision right here. It was a lot more painful than I expected. I spent 3 days in the hospital because I had some issues. The recovery is hard. It is painful. It is difficult. But that's to be expected. I can't take prescription pain medicine because I have a lot of allergies. So if you're someone who can take prescription pain medicine, I'm sure it wouldn't be as traumatic as it has been for me. I still can't do anything. I'm to walk on the treadmill 1/4 mile every day. I do that, but that is painful. I have a lot of pain through my shoulders and the back of my neck. The incision itself hasn't been very painful, but my esophagus has been very difficult to deal with. When they go through the front, they move your esophagus to the side so they can get to it, and that causes swelling and soreness. So I've been on a liquid and soft food diet. Swallowing things is difficult. When I was in the hospital, the medicine that I did take had to be crushed and put into applesauce so I could swallow it, because I couldn't swallow the pills for anything that didn't go in my IV. Swallowing is still a little bit difficult. My throat is still sore, but the incision itself hasn't been terribly painful. That part's not been too bad. It's uncomfortable, but it's not terribly painful. This week I could stop putting bandages over it, but the steri strips that are on there, they said leave those, they'll come off by themselves, and the stitches are dissolvable so they don't have to be taken out. I go back to the doctor in 1 week for a checkup to see how everything's going. And something that's been concerning is the left side of my tongue and the left side of my mouth, a little bit of my cheek, feels like when you go to the dentist and you get Novocaine shots and it isn't completely woken up, it still feels like that. So it feels like it is not, like the nerves have not completely healed. My hope is that when the inflammation goes down and things heal, that will get back to normal, because that also makes eating a little bit more difficult. Overall, I think it's going as expected. My husband, thank God for him, because I cannot do anything. He is doing all the shopping, doing all the cooking, the cleaning, having to help me take a bath, because you cannot raise your hands up. You can't bend forward. You can't turn your neck left or right, up or down. You have to hold your head still. That's the reason for this horrendously uncomfortable collar. He's doing everything. He's a blessing, and I'm very grateful for him. I have a wonderful husband. When I was in the hospital, this is an important thing. When I was in the hospital, something occurred with a nurse who was not my nurse. And this is why, if you are ever in the hospital, if you are ever in an emergency room and they come at you with medication, ask them, what is it? What is it for? Ask them to show you the vial that the medicine came from. I always do that because I have had a prior very bad experience. But a nurse came into my room who was not my nurse. My physical therapist was in my room at the time. And I had stayed extra because I had issues with my blood pressure being too low. So this nurse came into my room. She did not scan my bracelet like they're supposed to do when they first come in your room. And she pulled up a patient on the screen that's in the room. And she said, I have 2 medications to give you in your IV. And I said, what is that? And she said, one's a blood pressure medicine and one is a blood thinner. And I said, why would I be getting a blood pressure medicine? My blood pressure is too low. I'm not getting a blood pressure medicine. And nobody has mentioned anything to me about a blood thinner. So I don't understand why you're here with this medication. She said, well, it's in your chart, so we have to give it to you because your chart says your blood pressure is high. No, my blood pressure is too low. So then the physical therapist went to the screen and looked at the screen and said, that is not this patient. That is the wrong patient. You are in the wrong room. Now, what would have occurred had I just said, okay, and let this lady give me this medication? Now, I did report it. I did put it also on my survey when they sent the survey. But you are responsible for your own health when you're in a situation like that. So always ask questions. Don't feel bad about asking questions. It's your health. It's your life. Always ask the questions. You want to know what you're getting and why you're being given that medication, because that could have been really dangerous had I just let her give me that medication, because she was not doing her job the way her job was supposed to be done. When they come into the room at this particular hospital, the first thing they're supposed to do when they come in your room is identify themselves and scan your bracelet to make sure that they have the correct patient. She didn't do any of that. So hopefully that is addressed. But mostly I just wanted to give a little quick update. I'll be okay. The pain is still pretty bad. I'm still taking muscle relaxers and Tylenol because that's just about all I can do. Hopefully they'll let me back on my anti-inflammatory medication soon. When you have this surgery done, they don't want you taking anti-inflammatories because something about the healing process, it can interfere with the healing process. So I'm hoping that all of that helps with the nerve issues that I'm having and the pain that I'm having, but it gets a little bit better each day. So till next time, I'll give you another update after I see the doctor. Have a wonderful day.